baby.
You can check the baby when I'm done, please, sir.
But I need to move that up higher.
Thank you.
Could you move it higher?
So the other part of the assessment is the T, which is for type of nipple. So here we're just looking at your nipples to see what shape they are. It is easier for a baby to breastfeed if you have an everted nipple.
Okay, pause.
That means the nipple is sticking out.
I said pause.
Stop. We're looking for an everted nipple, which means after it's been stimulated, it sticks out. Some mothers may experience a flat nipple, which means it is flat up against the breast. And then what we don't want is an inverted nipple. Those two are not very conducive to breastfeeding. The C is for the comfort, what you're experiencing in your breast or nipple. We mentioned this briefly earlier. If you're having engorged, cracked, bleeding, or bruises on your breast or nipple, and severe discomfort, that is something we obviously do not want. We obviously don't want to see reddened or small blisters, bruises on your breast or nipples. The ideal is to have soft, non-tender breasts and nipples. That would score a +2. And then the H of the latch assessment. The H of the latch assessment is for the hold or positioning.
But I didn't done it yet.
So you may, at first at least, experience full assist from staff. This means that the staff holds the infant at your breast as you're breastfeeding to try to help the baby learn how to do so. A +1 would be a minimal assist, so perhaps the nurse or a support person needs to...
Sorry. I didn't mean to.
Then stop it.
Get over here. Okay, we're going upstairs.
No!
The holder position, +1, minimal assist. So you might need to elevate the head of the bed or place pillows for support. So you may need to put one under your arm.
I want pillows for support. No, I don't want to go upstairs.
So the lactation consultant may teach you the appropriate way to breastfeed on one side, and then you practice on the other. So we're kind of taking turns as you go along for this. This is the +1. So +2 for the holder positioning is when you have no assistance from us, the lactation consultant, or any other nurses, you're able to position the infant and hold them as you feel comfortable. All that, we would add those up and get a total score, and this would help us assess how well you are doing with breastfeeding. I will provide this sheet for you because it gives you some pictures of the different positions to hold your baby. You know, it is very good when you're breastfeeding that you talk to your baby, that you maybe sing or just engage with your baby, even though he is focused on eating. You can build a bond with your baby through talking and singing, maybe even telling a story. This does help form attachment to each other. You know, look at your baby in its eyes and just talk to it. I'll have this over here with your information about the Percocet that we prescribed and give to you earlier. Now I do want to mention, if you experience hard, red, hot, painful, swollen area in your breast and a fever over 101, you want to call your doctor. You may have developed mastitis, and they would have to get you an antibiotic for that. It is an infection in your breast. It occurs typically in mothers who do breastfeed, but sometimes it occurs in mothers who do not breastfeed. So if you notice that along with flu-like symptoms, make sure you call your doctor and get it checked out. It is very uncomfortable, but it will go away. Another thing I would like to talk to you about, if you do decide breastfeeding is not correct for you, and you are just going to do bottle feeding or maybe the formula feed,
I was tapping the answer.
you want to make sure you wear a clean support bra or ace bandages maybe wrapped around your breasts. You will experience engorgement for the first couple of days until your milk supply stops producing. Try not to stimulate your breasts because the milk will be released, and if it's released it will produce more as it's released. So it'll keep up that cycle of producing if it is let down. Try to avoid hot showers. Stand with your back to the water, not your front. That way your breasts are not being stimulated. And like I said, that engorgement typically occurs between 3 and 5 days after delivery. Wear that tight bra. Use an ace bandage, and you can also use ice packs. I have heard of some women using cabbage leaves. I personally don't know if that works, but I've heard a lot of things about cabbage leaves being over your breasts and helping with the swelling. It is important, just some general information. If you experience heavy bleeding, you make sure you call your doctor. These are things that you need to worry about. Anytime you're having severe chills or fever greater than 100.4, if you're having unusual chest pain or shortness of breath, if you experience pain or tenderness in your leg and it swells and feels warm, also something called postpartum blues. It's very common for women after they give birth to feel down and sad. This typically happens because your hormones are going back down, going back to normal. You know, you've gotten that baby out of there. It is not uncommon to cry easily or be emotional for the first 7 to 10 days. It does happen. And they say that happens to approximately 85% of new moms. If it does persist for more than 2 weeks, you want to make sure you let your provider know. Also, if you're having feelings of suicidal behavior or harming your baby, seek help immediately, as those kind of feelings are not normal. I will give you this information as well. You'll be getting a whole big packet of papers to take with you. And of course, you can always call us if need be. Call your doctor. Reach out often if you need it. We're going to allow you some private time to work with a lactation consultant to breastfeed. And I will be back here shortly to check on you and see how you're doing.